Question number 1.
Nurse Mimi is giving education to group of students that the people at risk for developing Cushing syndrome are which of the following? A. People with tumor on the pituitary gland that leads to excessive release of adrenocorticotropic hormone, also known as ACTH. B. People taking glucocorticoids, prednisone, for several weeks. C. People with kidney diseases as adrenal gland is located above the kidney. D. People who are post-op from an adrenalectomy. Let's apply the process of elimination. Option A is referring to Cushing's disease. Don't be confused. Cushing's disease and Cushing syndrome are two different illnesses. Here are their comparison. They both increased production of glucocorticoid cortisol. The only difference is their cause. In Cushing syndrome, it is mainly due to medication intake of steroids such as prednisone and tumor in the adrenal glands that triggers the excessive release of cortisol. While in Cushing's disease, there is only one cause, which is a tumor in the pituitary gland. In a normal situation, the pituitary gland releases adrenocorticotropic hormone to trigger the adrenals to release cortisol. If a tumor grows in the pituitary, it irritates the gland, further releasing unnecessary ACTH that also leads to excessive release of cortisol, which is known as Cushing's disease. Therefore, option A is incorrect. Option B. People taking glucocorticoids, prednisone, for several weeks is a correct definition of people at risk for Cushing syndrome. Option C. Although the adrenal glands are located above the kidney, people diagnosed with kidney diseases doesn't have any correlation with adrenal problems, which makes this statement incorrect. Option D. People who are post-op from an adrenalectomy is the opposite cause for Cushing syndrome. Instead, they are more likely to develop Addison's disease, which is the opposite condition of Cushing's. Therefore, the correct answer is letter B.
Question number 2.
Which of the following is not a typical sign and symptom of Cushing syndrome? A. Hyperpigmentation of the skin. B. Hirsutism. C. Purplish striae. D. Moon face. The correct answer is letter A. Hyperpigmentation happens in Addison's disease, which is the opposite condition of Cushing syndrome. Hirsutism, purplish striae and moon face are typical signs of Cushing's. To better understand why these signs and symptoms occur, let us know the physiology of the adrenal glands. The adrenal glands are made up of three parts. First, we have medulla. It is the innermost layer that is responsible for producing the fight and flight response, epinephrine and norepinephrine. Next, we have the adrenal cortex. It is considered as the largest part of the adrenal gland. It is responsible for producing aldosterone and cortisol in the body. The third part would be the capsule, which serves as the outer covering of the gland. Let's focus more on the adrenal cortex. Aldosterone is also known as mineralocorticoid because it controls blood pressure by keeping the balance of water and salts in the kidney, keeping sodium in and releasing potassium out of the body. Cortisol is also known as glucocorticoid because it responds by increasing sugar glucose in the bloodstream. It enhances your brain's use of glucose and increase in availability of substance that repairs tissues. This hormone is mainly affected in Cushing syndrome. Now that we have understand how the adrenal glands and its hormones work, let us go back to the signs and symptoms of Cushing syndrome. So how can we easily remember its signs and symptoms? Just remember the word stressed. First, we have S for skin is fragile, sometimes called thinning skin. Here is the comparison of the skin that is fragile versus normal skin. This is because cortisol causes the breakdown of some dermal proteins along with the weakening of small blood vessels. T for truncal obesity with small arms. The trunk covers from the chest down to the pelvis. Cortisol in the presence of relatively high glucose concentrations can promote the deposition of central body fat while extremities waste, causing thin arms and feet. R for rounded face, also known as moon face. Here is a picture in comparison with moon face. This happens because fat deposits shift, causing your cheeks to get puffy and your jawline to fill out. E for ecchymosis and elevated blood pressure. Cortisol has negative effects on keratinocyte growth factor, and collagen suppresses wound healing, leading to ecchymosis or bleeding underneath the skin. The elevation of blood pressure is due to sodium retention. As the saying goes, where sodium goes, water follows. S for striae on the extremities and abdomen that are purplish. This is due to increased deposits of fats in the subcutaneous tissue and also fragile skin, leading to striae. Next, sugar extremely high. Elevated cortisol over the long term consistently produces glucose, leading to increased blood sugar levels. E for excessive body hair. Women with Cushing syndrome may have signs for hirsutism or growth of coarse body hair in a male pattern. This is due to adrenal cell proliferation, leading to excessive release of male hormone androgen. Lastly, D for dorsocervical fat pad, also known as buffalo hump. High levels of cortisol can lead to increased fat synthesis. The fat produced often deposits in the neck, known as lipodystrophy. This produces the characteristic of a buffalo hump.
Question number 3.
Malone was diagnosed with Cushing syndrome and will be undergoing an adrenalectomy. Which of the following will be included in the patient's discharge teaching after the procedure? A. Glucocorticoid replacement therapy. B. Avoiding fatty foods. C. Augmentin amoxicillin therapy. D. He will experience signs and symptoms of Graves' disease. The correct answer is letter A, glucocorticoid replacement therapy. If you have had adrenal glands removed, you will be given supplemental steroids such as prednisone, prednisolone, or dexamethasone to replace the hormones previously made by your adrenal glands. Avoiding fatty foods are not necessary for patients who have undergone adrenalectomy, as fats from foods we eat are taken care of by our gallbladder, which is not affected by the procedure, making option B incorrect. Augmentin antibiotic therapy is not the main course of a discharging patient, since the patient is already going home. It is already understood that wounds from the operation has been taken care of, which makes option C incorrect. Graves' disease is an immune system disorder that results in the overproduction of thyroid hormones, hyperthyroidism, which is not related to Cushing syndrome, making option D incorrect.
Question number 4.
Malone undergone adrenalectomy is being discharged home on prednisone medication. Which of the following statements by the patient warrants you to re-educate the client? A. I will take this medication as needed when symptoms present. B. I will notify the doctor if I become sick or experience extra stress. C. I will take this medication at the same time every day. D. I will buy a medic alert bracelet. Let's apply the process of elimination. Option A. I will take this medication as needed when symptoms present is an indication that the patient did not understand how to take steroids. It should be taken with or without symptoms as part of maintenance. Patients should not wait for symptoms to appear before taking the medication. Therefore, this warrants a red alert to the nurse. Option B. Notifying the doctor when feeling sick or experiencing extra stress is a correct statement by the patient. Option C. I will take this medication at the same time every day is the correct way of taking the medication. Option D. Medical alert bracelets alerts your emergency responders from your circle of care when you press the help button. This is a good practice which doesn't require further education. Therefore, the correct answer is letter A.
Question number 5.
Addison's disease is a condition in which of the following statement is correct? A. Increased secretion of cortisol. B. Increased secretion of aldosterone and cortisol. C. Decreased secretion of cortisol. D. Decreased secretion of aldosterone and cortisol. The correct answer is letter D. Decreased secretion of both aldosterone and cortisol. Addison's disease, also called adrenal insufficiency, is an uncommon disorder that occurs when your adrenal glands produce too little cortisol and often too little aldosterone.
Question number 6.
Which of the following is not a typical sign and symptom of Addison's disease? A. Increased pigmentation of the skin. B. Tired and muscle weakness. C. Low in blood sugar. D. Overgrowth of body hair. The correct answer is letter D. Overgrowth of body hair. This is a symptom under Cushing syndrome, which is an opposite condition to Addison's disease. Options A, B, and C are all signs and symptoms of Addison's disease. So how can you easily remember the symptoms of Addison's disease? Just remember the acronym steroid. S for sugar and sodium low for the reason that sugar and sodium retention are managed by aldosterone and cortisol. T for tired and muscle weakness. Cortisol is necessary for stress response, giving our body energy. Thus lack of cortisol leads to weakness. E for electrolyte imbalance of high potassium. Since aldosterone keeps sodium in and potassium out, lack of aldosterone increases potassium level while lowering sodium level. R for reproductive changes. Women with Addison's disease may have irregular menstrual periods, lose body hair, and have a decreased sexual drive due to decreased production of androgens, which is also a factor of sexual behaviors. O for low blood pressure. Given that low cortisol lowers your sodium retention, it also lowers water retention in the body, thus significantly decreases your blood pressure. As the saying goes, where sodium goes, water follows. I for increased pigmentation of the skin. Since cortisol is low, pituitary glands secretes more adrenocorticotropic hormone to trigger more cortisol production. This adrenocorticotropic hormone has melanocyte-stimulating activity, causing increased pigmentation on the skin. D for diarrhea. Patients experiences diarrhea and vomiting in severe cases with Addison's disease.
Question number 7.
Patient Malone was admitted to the emergency room. He was unconscious upon arrival. His mother informed Nurse Mimi that Malone was complaining of severe pain in the abdomen, legs, and back, and has been experiencing worsening confusion. The patient previously had adrenalectomy due to Cushing syndrome. On assessment, you note the patient's blood pressure is 70/45. Nurse Mimi would expect that Malone experienced the following, except A. Addisonian crisis. B. Low in cortisol levels. C. Have not taken prednisone medication. D. Increased level of aldosterone and cortisol. Let's apply the process of elimination. The scenario described above is what we call Addisonian crisis. It is a life-threatening situation that results in low blood pressure and low blood levels of sugar due to low level of aldosterone and cortisol in the body. In worse cases, it can even lead to death. This makes option A correct. Option B, low cortisol level, is the major cause of Addisonian crisis, which makes this statement correct. Option C, one of the reasons why post-adrenalectomy patients experience Addisonian crisis is that they have missed to take their hormone replacement medication such as prednisone. This makes statement C correct. Option D, excessive level of aldosterone and cortisol, is the opposite condition of Addison's disease. This makes statement D incorrect. Therefore, the correct answer is letter D.
Question number 8.
In the scenario given in number 7, what medication do you expect the patient to be started on? A. PO prednisone. B. IV Doricef, cephalosporin. C. IV Lispro, insulin. D. IV Solucortif, hydrocortisone sodium succinate. Let's apply the process of elimination. The patient is unconscious and cannot take oral medications, therefore prednisone is not the best option, making option A incorrect. Cephalosporin is a type of antibiotic which is not needed in the scenario, making option B incorrect. Insulin will just worsen the scenario as Addisonian crisis is already low in sugar, which makes option C incorrect. The patient needs cortisol immediately because they are experiencing Addisonian crisis. IV Solucortif is the best option because it is intravenous and a glucocorticoid. Therefore, the correct answer is letter D. How many correct answers did you get? I know you got it all correctly, but wait, don't forget to hit on subscribe button and turn on notification bell so that you will be notified for upcoming videos. You can also share this to your friends. Goodbye.